and many of us meeting here today will know personally of someone who has been impacted personally by the disease. Some may also have lost family members, colleagues, and or friends. Having been a head of government and Minister of Health myself, I am passionate about investing in robust and resilient national health systems, which enable us to cope not only with this pandemic, but also with the inevitable next outbreak of a disease with the same potential to spread as COVID-19 has. As members of the WHO Executive Board, you all appreciate that we need health systems which focus not just on any specific pathogen, but systems which provide people with access to essential health services in general, that is, with universal health coverage. We must invest in health systems at large to enable people to lead healthier lives no matter where in the world they are. With those introductory comments, let me hand over to President Sirleaf, who will now give an account of our panel's steps to date, including the determination of the terms of reference, the selection of panelists, and the establishment of the Secretariat. Thereafter, I will brief you on the first panel meeting, the development of our plans going forward, and our suggestions for how we can continue to engage with the Executive Board, member states, and the broader community concerned with global health and health security. For now, it is over to President Johnson Sirleaf.
Thank you, Prime Minister Clark. Greetings to all of you from Monrovia, Liberia. Let me also thank of the independent panel to brief you today. I bring to the work of the independent panel the experience of a president who was faced with leading the effort to fight an unknown enemy, the Ebola virus. I will speak on 3 important steps relating to the independent panel's formation. The process that went into developing its terms of reference, the process used to select the panelists, and the diversity of talent and expertise they bring to the task, and the establishment of the Secretariat. First of all, we based our terms of reference on World Health Assembly Resolution 73.1. My co-chair and I prepared a draft of the terms of reference with support from our advisors and the Secretariat. We then shared the draft with you member states and requested your comments. We would like to thank all the member states who provided feedback. We took it into account when finalizing the terms of reference. These are now available online on the independent panel's website. As you can see from this slide and from our terms of reference, we will need to work closely with the review committee on the international health regulations and the independent oversight and advisory committee. We have already connected with these bodies at chair and secretariat level. Second, I would like to brief you on the process used to select the panelists. With the support of our advisors, we considered more than 120 names of excellent potential panel members. We thank member states for their panel nominations. we had the difficult task of narrowing that list to the 11 who have joined us on the panel. When processing your nominations and considering names, we had clear criteria in mind for the skills needed on the panel. There were the criteria set out in the circular letter to member states, such as the importance of selecting independent panelists who are not current political appointees. We endeavored to have broad geographical representation and to be gender balanced. Then we wanted specific competencies and skill sets presented, including clinical and research expertise and experience of steering national health systems, but also relevant additional competencies in economics, diplomacy, and knowledge of the international system, and experience of working directly with communities affected by disease outbreaks. Such skills and experience are needed in the ongoing response to COVID-19 around the world, and it is important that they are represented on the panel. We are pleased to have chosen 11 exceptional panelists representing a wealth of experience and technical expertise in leadership, global health, public administration, and in leading response to difficult disease outbreaks and crises, economics, the well-being of girls and women in national and international health policy, and in investigating some of the first known clusters of COVID-19. This is an excellent team of esteemed and independent people from around the world with a wide mix of skills we sought, and comprised of 7 women and 6 men. It is a strong, diverse, and independent panel, and it is now poised to ask the hard questions. Its work will be informed by and drawn from additional knowledge and expertise of you, member states, and the wider health, scientific, and civil society community. Finally, I would want to cover the establishment of the Secretariat. We have a Secretariat led by Anders Nordstrom, which is now supporting the work of the panel. It too is made up of people with diverse skill sets from around the world. Ensuring the independence of the work of the panel is important. The Secretariat, therefore, has its own office outside WHO. It is financed exclusively by assessed contributions by member states. The Secretariat reports directly to us, the co-chairs of the independent panel. The Secretariat will support us to engage with you member states on the independent panel's plans and work in the weeks and months ahead. Your knowledge and suggestions are most important, and we will continue to engage with you member states regularly. I now hand over to my co-chair, Right Honorable Helen Clark, to talk more about our first panel meeting and our next steps, including how you might help us to achieve our objectives.
Thank you very much, President Sirleaf. Mr. Chairman and members of the board, let me now give an overview of the first panel meeting, which was held virtually on the 17th of September. All panel members attended, and we felt it was a very productive meeting. We first reflected on our experiences with the pandemic and how that informs our work as panelists. Panel members themselves shared their stories of how they and their families had been impacted, including by the death of family members. Each panelist said not only that they felt honoured to be part of this group, but also that they were deeply committed to reviewing the international response and making recommendations to help for the future. We concluded the meeting knowing that this panel as a group is approaching the complex task set out in Resolution 73.1 and the terms of reference in a very genuine and serious manner. The panel agreed that, as is set out in the terms of reference, we will focus on coming to an objective understanding of the key events which have led to the pandemic and where it stands today. And we will distill lessons learned from that, from which we will base our recommendations. The panel agrees that the recommendations we make should be practical and able to be implemented. These recommendations could help with course correction as the pandemic continues, whilst also contributing to better preparedness for the next potential pandemic. At this inaugural meeting, the panel agreed to focus on three main themes of inquiry: changing for the future, developing an analysis and a vision for a robust and strengthened international system equipped to support effective pandemic preparedness and response, reviewing the present, providing an analysis of the present response to the pandemic from its initial phase through to the present, including the global alerts, the spread, the country responses, and wider societal impacts. And then learning from the past, learning the lessons from previous outbreaks and pandemics to help understand why this COVID-19 has spread globally and had such an impact. We also wish to understand the characteristics of the response of the World Health Organization and of relevant institutional and national responses. As a panel, with the support of our advisors and secretariat, we've been busy structuring these themes into a detailed program of work, which we look forward to sharing with you shortly. At the first meeting, we also discussed our methods of work. We agreed to use a variety of research and information collection mechanisms, as you can see on the slide on the screen now. These will be guided throughout by high standards of rigor and objectivity and by our panel's commitment to impartial truth-seeking. We will be working collaboratively with parallel mechanisms, including with the Global Preparedness Monitoring Board, with the International Health Regulations Review Committee, and with the Independent Oversight and Advisory Committee. President Sirleaf has mentioned how we have already connected with each of these bodies, and our secretariat are in frequent contact. While we each have distinct responsibilities and mandates, we're keen to draw on each other's work and avoid duplication. You will see from the detailed slide on the screen that we've already begun to map out and analyse our respective scope of work, composition and timelines. We will make this slide deck and a written copy of the remarks we're making to you today available on the Independent Panel's website after this presentation. We look forward to hearing from our colleagues from the International Health Regulations Review Committee and the IOAC immediately after our presentation here today. With regard to our timeline, the panel has agreed to meet approximately every 6 weeks. Each meeting will have a clear agenda and set of papers based on the program of work. And our next meeting is scheduled for the 20th and the 21st of October. We do look forward to sharing that meeting report with member states and with continuing to engage with you at the monthly briefings. We also look forward to reporting to the resumed 73rd World Health Assembly meeting next month before presenting to you again at the next Executive Board meeting in January. Throughout our process, we do wish to engage with and learn from you, the member states. We are committed to being open and transparent. You will have seen that we've already published the report of our first meeting and the background papers for it on the panel's website. Today, we are announcing that we are inviting member states to make submissions to the panel based on your experiences of the pandemic and the suggestions you have for moving forward from here. These contributions will be very important inputs to the panel's work. They will be made public in order to stimulate learning and knowledge sharing. More details about the call for submissions are on the independent panel's website. In due course, we will also provide information on processes for receiving input from other stakeholders and from the general public. We believe this is very important. To wrap up our presentation, President Sirleaf and I are very pleased with the level of engagement, quality, and diversity of our panelists and with the outcomes of our first panel meeting. We look forward now to hearing from the chairs of the IHR Review Committee and the IOAC, and then to hearing feedback from you, members of the Executive Board. Thank you all for listening, and can I now hand the floor back to you, Mr. Chair.
Thank you, Excellencies. I shall now give the floor to Dr. Arthur Wheeler, Chair of the IHR Review Committee, for an update on the functioning of the IHR during the COVID-19 response. Dr. Wheeler, you have the floor, please.
Excellencies, distinguished guests, co-chairs of the independent panel, Chair of the IOAC, Dr. Tedros, it is my great pleasure and honor to present you today on the progress made by the International Health Regulations Review Committee on the functioning of the IHR during COVID-19. And may I have the first slide, please? And the second can directly follow. As you know, the committee was convened by the WHO Director General on the 8th of September at the request of the World Health Assembly Resolution WHA 73.1. The review committee's function under the IHR is to make technical recommendations to the Director General regarding the functioning of the IHR and propose any amendments of deemed necessary. In the next slide, you will see the terms of reference of our work, which we will include a review of the functioning of the IHR during COVID-19 with reference to relevant provisions of the IHR, including but not limited to, first, outbreak alert and verification. Second, information sharing and communication. Third, international coordination and collaboration. Fourth, convening the emergency committee and declaration of a public health emergency of international concern, the FIC, including the need for an intermediate level of alert. Fifth, additional health measures in relation to international travel. Sixth, IHR core capacities, implementation and reporting. We will, of course, also look at the progress made in the implementation of those recommendations of previous IHR review committees. And in that regard, we have already interviewed the two chairs of the previous three review committees. The next slide presents you with the members of our committee, and I have the honor to work with 22 extremely knowledgeable experts. They have been selected and appointed by the Director General from the IHR roster of experts with due consideration for geographic and gender representation. I'm supported in my function as chair by our vice chair, Professor Lucille Bloomberg from South Africa, and our rapporteur, Dr. Preben Arvidsland from Norway. We are also supported by a very hardworking and dedicated secretariat for our committee. Let me show the progress in our next slide. So far, we have met 4 times already in closed virtual meetings, once every week since the 8th of September, and will continue to meet weekly. We had one open meeting on the 9th of September, where more than 60 member states attended, as well as 5 UN agencies and 25 non-state actors. Tomorrow, we will have our second open meeting. Open meetings are planned by us monthly. During open meetings, but also through the Secretariat, member states are invited to provide input to the committee, and a number of them have done so already. We very much welcome and appreciate such inputs from member states, obviously. We started off with a long list of questions relating to the terms of reference. The committee members have now organized themselves in 3 subgroups to prioritize these questions and do the necessary analysis. The subgroups are also meeting weekly. At the moment, the focus on identifying additional documentation required and resource persons for interviews, as well as to review submissions from member states. We have so far received submissions from 7 member states. And I can only repeat, the inputs from member states are extremely useful for us. Actually, they are absolutely necessary. To do our work well, we need to understand your concerns and conduct our deliberations in light of what you think about the functioning of the IHR, as they are your legal instrument. The next slide gives you the 3 subgroups. They focus on preparedness, alert, and response. The slide shows the preliminary areas for consideration. We are at an early stage in our deliberations, so I cannot tell you any specific findings yet. What I can say is that for each area, we look at the specific articles of the IHR, assess how the provisions of these articles have been implemented, and then judge whether any issues are about a lack of implementation or about the provisions themselves. Now let's turn to the second last slide. Here I want to report also that we will have close coordination and collaboration with the other two panels, as the Director General mentioned several times, as our work is highly complementary. I already had a discussion with the chair of the IOIC, Dr. Felicity Harway, and with the Secretariat and the advisors of the co-chairs of the IPPR. We are now scheduling a meeting with Madam Helen Clark and President Ellen Johnson-Sirleaf, co-chairs of the IPPR, for the coming days. We agreed to map out for each of the three panels the areas for consideration and the depth of focus to ensure proper complementarity of our work. Also, IOSC has shared observations on the IHR during the initial response to COVID. I am sure my colleague, Dr. Felicity Harway, will mention those observations in her report. In the last slide, I show you the extremely packed agenda and timeline with weekly meetings of the subgroups and the plenary committee, and monthly meetings with member states. We strive to deliver first results of our review as soon as possible and after very careful deliberation. I thank you for your attention, and I remain at your disposal for any questions. Thanks for giving me the floor. I'm looking forward to the good cooperation also with all members of the other panels. Thank you very much.
Thank you, Dr. Lothar. I shall now give the floor to Dr. Felicity Harway, Chair of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program, for an update on WHO's response to COVID-19. Dr. Harway, you have the floor, please.
Thank you, Mr. Chairman. Your Excellencies, honourable members, co-chairs of the independent panel, chair of the IHR review, and distinguished guests and colleagues, I thank you very much for the opportunity to present our committee and share some of the findings on WHO's response to COVID-19 that we published in our interim report on the occasion of the virtual WHA session on the 18th of May. I wonder if I could have the first slide, please, and then on to the next one. Thank you. As background, following the West African Ebola crisis, the WHO Secretariat was urged to undertake organisational-wide reform to strengthen its operational capacity to enable it to respond more effectively to outbreaks and emergencies. The Independent Oversight and Advisory Committee, IOC, was established, as many will remember, in May 2016, at the same time as the WHO Health Emergency Programme was established, which was in line with WHO Decision 69-9 and was as a result of WHO's reform of its work on outbreaks and emergencies. WHO officially launched the Health Emergency Programme on the 1st of July 2016 to reposition WHO as a UN specialised agency with operational functions for managing health emergencies whilst maintaining its technical expertise. Next slide, please. Our terms of reference. We were created to provide independent scrutiny of WHO's implementation of the reform and its ongoing management of health emergencies. The purpose of IOC is to oversee and monitor the performance of the WHE programme, guide the organisation's activities in health emergencies, and report its findings to the World Health Assembly. Our functions are, as it says on the slide, to assess the performance of the organisation's emergency work in preparedness, prevention, detection and response, to assess the performance of the WHE's programme's key functions in all emergencies, including graded emergencies and infectious disease outbreaks, to review the adequacy of the WHE's financing and resourcing, to prepare reports on our activities containing our conclusions and recommendations, which we then submit to the World Health Assembly. We also provide advice to the Director General on issues within our mandate, and these terms of reference are published. Next slide. The IOC is comprised of up to 8 members who have proven experience in senior positions in the areas covered by the scope of the committee. For example, public health, infectious disease, public administration and government, humanitarian crisis emergency management, community engagement, partnerships and development. IOC has been functioning since May 2016, and it originally comprised 8 members appointed by the former Director General, Dr. Margaret Chan, and currently we have 6 active members, as you can see from the slide, with 2 additional members who we hope will join soon. The current membership was announced during the 71st World Health Assembly in May 2018, and at the completion of our 2-year term of office in May 2020, Dr. Tedros invited IOC members to serve the committee for a 3rd term until May 2022. Importantly, we serve in a personal capacity. We don't seek nor accept instructions from any government or any authority, either external to or within WHO, and we exercise our responsibilities with full regard to the paramount importance of independence. Next slide, please. We use a combination of working methods: teleconferences, in-person meetings, field visits, which we feel are very important, desk reviews, surveys, and interviews with member states, partners, donors, NGOs, and other key stakeholders. And since May 2016, we've held 25 statutory meetings, numerous ad hoc interviews and consultations by phone and video conference, surveys with the heads of WHO country offices and partners on the ground, and we've carried out field visits to Bangladesh, Colombia, the Democratic Republic of Congo, Iraq, Mali, Pakistan, Turkey, Uganda, and Vietnam. At the establishment of the committee in 2016, we developed a monitoring framework as a tool to assess the WHE programme and to track progress against the milestones laid out in document A6930, which was the Director General's report to the 69th World Health Assembly on reform of WHO's health emergency management. Over time, IOC has updated the monitoring framework with new areas and indicators as the programme has evolved. For the first term of office from May 2016 to 18, IOC assessed whether the reform of WHO's work in health emergency management was on track, with a focus on 8 thematic areas: structure, human resources, incident management, risk assessment, business processes, partnerships, finance, and, very importantly, international health regulations. In the light of WHE's demonstrated progress and the launch of GPW 13, IOC revised the monitoring framework and will focus on the transformation agenda, the WHO Secretariat's work to support countries in strengthening their IHR core capacities, and selected thematic areas that need to be kept under review in our future work programme. Next slide, please. IOC's findings and observations have been presented to WHO's governing bodies through 7 reports. During 2016 to 19, we conducted the 10 field missions I referred to, and I would like to take this opportunity to thank Bangladesh, Colombia, DRC, Iraq, Mali, Nigeria, Pakistan, Turkey, Uganda, and Vietnam for accommodating the IOC field missions in their countries. Very many thanks. And all our mission reports are published on the website. IOC was commissioned by the GPMB, the Global Preparedness Monitoring Board, last year to review the Ebola response in DRC. And in May last year, we published this. The committee also undertook a special project during February and March 2019 to provide advice in relation to promoting diversity within WHO Health Emergency Programme and to review issues that were impacting on staff morale and impeding the programme from performing optimally. The mandate of IOC is to oversee the WHO programme and advise the Director General on relevant issues. And in keeping with this mandate, we submitted an interim report to Dr. Tedros with our preliminary findings on WHO's response to COVID-19 between January and April 2020. All meeting reports and the matrix for tracking progress have been published on our website. Next slide, please. I would now like to present to you some of the interim findings that we had from April up to April of 2020. I'd like to emphasise that this interim report, which is published, is not a comprehensive assessment of the COVID-19 response, but it is a compilation of observations of how the structures and processes established by WHO through the WHE programme and related mechanisms functioned between January and April 2020 in the context of the COVID-19 response. In the interim report, we noted that it would be useful to independently assess the organisation's performance and identify lessons for the future. And the IOC welcomes Resolution WHO 73.1 and the establishment of the Independent Panel for Pandemic Preparedness and Response and the IHR Review Committee for COVID-19, both of whom we just heard from. We are working very closely, as has been said, with the Independent Panel and the IHR Review Committee, and we would like to affirm our commitment towards impartial, independent and comprehensive evaluation as was requested by Member States. Next slide, please. The committee made a deliberate effort not to disrupt WHO's ability to respond effectively when we conducted our review during the peak of the outbreak in April. The interim report was informed by the WHO Secretariat briefings, desk reviews, and interviews with selected numbers of WHO headquarters and WHE staff members and external global health experts. Following the notification of a cluster of cases of pneumonia in Wuhan City in China on the 31st of December 2019, we observed the extraordinarily rapid evolution of the outbreak and the WHO Secretariat's actions to provide updates and technical guidance to Member States. An imperfect and evolving understanding is not unusual during the early phase of a novel disease emergence. Considering the novel nature of this virus and persistent unknown factors, WHO has demonstrated leadership and has made important progress in its COVID-19 response. The IOC commends Member States, the Director General, the regional directors and the Executive Director of the WHE programme, Dr. Mike Ryan, for their leadership and deep commitment to contain the virus. The IOC is impressed by WHO staff's dedication and hard work. IOC acknowledges the Director General's engagement with heads of state of WHO's membership to underscore political commitment and to address the global issues in a coordinated manner. The WHO Secretary has worked closely with existing networks and platforms and has established numerous new initiatives and partnerships with various stakeholders. The leadership role of WHO within the United Nations in global health emergencies has been dramatically strengthened through the COVID-19 pandemic. IOC noted that internal communication, decision-making processes, and the coordination across the three levels of the organisation have been greatly improved through the WHO Health Security Council meetings, the Senior Leadership Group, and the incident management system in the context of the COVID-19 pandemic, under the leadership of the Director General and the Executive Director of the WHE programme. The Secretariat activated its incident management system to coordinate the outbreak response on the 1st of January 2020, and it has been the core of WHO daily operations. IOC recognises the WHO's leadership in normative functions, as the number of WHO guidelines, as we heard yesterday, and technical advice documents on COVID-19 now exceed 400. However, in our review, IOC observed during the first months of the response that there was a gap between rapid communication of timely provision of guidance and between WHO's aspiration to lead technical guidance and the limits imposed by its workforce capacity to do so in the heat of a crisis. IOC observed that some WHO recommendations were challenging to implement, particularly in low-resource settings and for certain populations. The social and economic implications of recommending public health measures such as isolation and social distancing for populations living in overcrowded and insecure settings with inadequate access to food, safe water and sanitation, or for migrants with temporary or undocumented residential status, must be taken into consideration. We understand efforts have been made now to address this. In our previous reports, IOC has expressed concern that a substantial proportion of the funds for WHO are earmarked voluntary contributions, and that less than $300 million a year is too modest a budget for the WHO Health Emergencies Programme to implement all the activities needed to support member states with health emergencies and at the same time to coordinate a global response to pandemics. In our report in May, we noted the precarious financial situation has impeded strategic planning and human resources management and recommended that member states review WHO financing to ensure that the WHE programme will play a key role in global health emergencies with appropriate capacity. Next slide, please. Evidence collected from the IOC desk review indicated the initial process of providing information about the new virus was conducted within the parameters established within the IHR. On the 5th of January 2020, the WHE programme published the information that it had available in its first disease outbreak news on the WHO website. On the same day, it alerted all IHR national focal points through a post on the event information site. This was expanded to WHO situation reports on COVID-19 as of the 21st of January 2020, and since then the epidemiological data has been updated in the public domain on a regular basis. The WHO Secretariat issued its first travel advice on the 10th of January 2020 and made updated recommendations regarding travel. Over 100 countries took additional travel measures and significant escalation of travel restrictions occurred subsequently. Under the IHR, the DG convened the IHR Emergency Committee to address the outbreak on the 22nd of January. And at that meeting, committee members expressed views on whether or not the outbreak constituted a public health emergency of international concern, or FAKE. WHO declared the event a FAKE on the 30th of January 2020 at the second Emergency Committee meeting. The urgency with which member states took action based on the FAKE varied both in terms of the timing and the comprehensiveness of public health measures in response to COVID-19. This raises questions about whether member states view a FAKE declaration as a sufficiently clear trigger. The IOC notes that the design of the FAKE is very broad and very much welcomes the IHR Review Committee looking into this and other issues. Inputs that the IOC received suggest that the overall level of COVID-19 data reporting by member states under the IHR needs further improvement in terms of speed, consistency and completeness. The IOC observed that the quality of country reports varied, making it difficult for the WHO Secretariat to conduct comparable analyses of outbreak and readiness patterns across the multiple countries. The interim report recommended that the WHO Secretariat further streamline the reporting process and support countries in strengthening capacity to report on the information required under IHR. In our previous reports, we noted the voluntary JEE tool and National Action Plan development could be useful for identifying gaps, but that their impact on strengthening IHR core capacities was still unclear. IOC saw no clear relation between JEE scores and country preparedness. And response to COVID-19. And in the light of this pandemic, IOC recommended reviewing existing tools and framework for national and international preparedness to consider whether they need to be updated. The COVID-19 pandemic has accentuated WHO's core normative and standard setting roles more clearly than ever. IOC recognises WHO's efforts to coordinate the global research community and facilitate the process of multinational vaccine and therapeutic drug trials. WHO should continue to play that leadership role in ensuring equitable access and vaccines and therapeutics for all countries and effective delivery and stewardship, as was highlighted yesterday. This pandemic has called into question whether the existing and responsibilities that the IHR assigned to the WHO Secretariat and to member states are widely understood, fit for purpose, and still appropriate for a pandemic. IOC emphasises that WHO's Secretariat's actions are grounded in its duties and responsibilities under the IHR, and its performance must be reviewed in the light of member states' adherence to the IHR. Global health is a shared responsibility, and WHO and member states must both play their part. The world will not defeat this virus without greater global solidarity and stronger multilateral cooperation. IOC will continue providing oversight and monitoring of the WHO programme's performance in outbreaks and emergencies, including the ongoing response to COVID-19, by holding WHO accountable. We will submit our next report to the resumed WHA in November, which will summarise the progress of the WHO programme over the past 4 years and the progress with implementing our recommendations. For the third term of office, IOC has planned to submit 2 more annual reports to the WHA in 2021 and 2022, respectively. We congratulate member states for the WHO resolution on COVID-19, and we wish to thank member states for their confidence in IOC. We very much welcome the establishment of the independent panel and the IHR Review Committee for COVID-19, and has already been noted by the co-chairs, Her Excellency Ellen Johnson-Sirleaf and the Right Honourable Helen Clark and Professor Lothar Wieler. We are fully committed to working together to implement this resolution and indeed have already started to do so. I thank you.
Thank you, Dr. Harvey. I shall now open the floor for comments. But before I do, I would like to ask that EB members present in the room raise their nameplates only if they themselves are planning to deliver their statement in the room. Should they wish that a colleague on the virtual platform deliver the statement, then I would suggest that their colleague raise their hand on the virtual platform when we open discussion on the virtual platform. The floor is now open. I will give the floor first to EB members in the EB room. I shall now give the floor to Germany. Germany, you can have the floor, please.
Thank you, Chair. Mr. Chair, Director General, Excellencies, colleagues. I speak on behalf of the EU and its member states. The candidate countries of the Republic of North Macedonia, Montenegro and Albania, as well as the Republic of Moldova, align themselves with this statement. The EU welcomes the opportunity for an exchange on the work of the Independent Panel on Pandemic Preparedness and Response. We have very high expectations in terms of its impartiality, independence, and comprehensiveness, and highest quality possible. We thank the two co-chairs of the IPPR for their update. We also thank you, DG, for convening a review committee on the functioning of the international health regulations and for your collaboration with the Independent Oversight Advisory Committee. We look forward to all of these bodies working together to inform our future decision-making. And thanks for the light. In this sense, the evaluations should enable us to draw lessons from a pandemic for which we all should have been better prepared. The evaluations should also provide the international community with suggestions to improve the work of WHO and our collective preparedness and response under health emergencies. It will then be our responsibility as member states to guide the WHO Secretariat to translate the group's findings into concrete policy actions and to thus effectively and sustainably strengthen the global health architecture. Some of the EU member states have already submitted and will continue to do so elements to feed the reflections of these various groups. For example, we also support considering the long-standing idea of creating an intermediate level of alert. But we need the expertise of the Secretariat and of the evaluation groups regarding its definition, the consequences that will be attached to its activation, and the possible process for its implementation. We look forward to discussing ideas such as increased accountability of member states on preparedness, for example, through the establishment of a periodic review mechanism as proposed by the African Union and/or strengthening WHO's prerogatives in terms of access to information. Emphasis must also be placed on development of proper and unified health data collection at all levels. Finally, we support the strengthening of tripartite cooperation between the WHO, the FAO, and OIE to foster the One Health approach. Ladies and gentlemen, independent members of the various evaluation groups, the EU appeals to you. In your evaluations, do not be afraid to tell uncomfortable truths. In your recommendations, do not be afraid to challenge all us member states, to question current modes of operation, and to show boldness and vision. You can count on the full support of the EU and its member states. In return, we are counting on you to keep member states regularly informed of the progress of your work. Thank you very much.
Thank you, Germany. I shall now give the floor to Austria, to be followed by Romania. Austria, you can have the floor, please.
Thank you, Chair. Austria aligns itself, of course, with the statement of the European Union, its member states, and also thanks all of the chairs of the panel and the committees for the valuable reports, especially the interim report of WHO Response to COVID-19. The outcomes of the IPPR's assessment and the IHR review committee are essential for the future work of a strong WHO. Therefore, member states need to continue to play an active role in this process of the WHO reform, as a statement by the European Union already echoed. I mean, the EB has to be active in guiding through this difficult task of the IPPR and the findings of the different committees. Concerning the independent multisectoral Pan-European Commission for Health and Sustainable Development under the leadership of Mario Monti, which was jointly set up by Dr. Kluge and Dr. Tedros, it is of interest what the panel's general position towards the Monti Commission is. Does the EPPR intend to draw lessons from its finding for the global level? But I want to draw your attention to some exemplary and practical key questions in the response toward COVID-19, which have to be looked into carefully and without any restraints. And I do see already first points mentioned by our presenters today. We all, from WHO upwards to the national, regional, and local governments, we all acted within a certain paradigm based on very little evidence about the virus, the pathogenity, the transmissibility, and the lethal effects on individuals. Therefore, in the beginning, some of us made severe mistakes in early diagnosing, testing, and treatment. For example, we learned very, very quickly that hospitals turned into super-spreading locations because even patients with mild conditions were treated there. A mistake with severe consequences. We also learned very quickly that the biggest threat to become sick is age, high age. The mortality and lethality in this risk group is tremendous. And we also learned very quickly to distinguish between symptomatic and asymptomatic cases with respected consequences. But I would like to draw to you another attention. In terms of the rule of law and the core values of human rights regarding certain liberties, we have to examine if many of the measures of lockdowns, national and international restrictions of free movement of people and goods, and others are in any means proportional to the epidemic development. We have to look without restraints in the global reaction toward the pandemic was in any way meaningful if you look at the numbers of excess mortality or other collateral harm caused by the postponement of treatments, the mental and the physical impact. Let me be clear. Everyone responded with best faith and intention. We worked within our crisis paradigms. There is no need to look after someone's guilty or wrongdoing. But the evaluations, and the many evaluations we are doing right now, they have to produce insights how we all, WHO and national, regional, local governments can react more meaningful according to the principles of proportionality when it comes to public health measures, economic shutdowns, travel restrictions, tourism, disruptions of our social, cultural, and sports life, the disruptions of our educational institutions, name it. No sector was spared by this crisis. At the end, we do need a new paradigm, how to react when the next global crisis will hit us. Thank you very much.
Thank you, Austria. Now I give the floor to Romania.
Thank you.
Romania, you can have the floor, please.
Thank you, Chair, Director General, Excellencies, dear colleagues, ladies and gentlemen. As expected, Romania fully aligns itself to the UN and Member States statement delivered by Germany. We want to thank for the update from the co-chairs of the independent panel for pandemic preparedness and response. It was very useful, And I think that building trust and transparency will strengthen the position of WHO as the leading agency in fighting SARS-CoV-2 pandemic. Romania as EB member fully support the activity of IPPR in order to give expected answers and solutions to improve executive activities delivered by WHO to all member states. Thank you very much.
Thank you, Romania. Now I would like to request that the Secretariat moderate the discussion, continuing first with EB members on the virtual platform. Secretariat, you have the floor, please.
Thank you very much, Mr. Chair, Dr. Harsh Vardhan. We shall now proceed with those wishing to make statements via the Zoom platform, those with their hands raised. First, we would wish to recognize the Republic of Korea, to be followed by Australia and then Singapore. Ambassador Lim, you have the floor.
Thank you, Mr. Chair. Thank you, Mr. Chair. I have the honor to deliver this statement on behalf of the core group of G4IDR, the support group for global infectious disease response, namely Kenya, Mexico, Morocco, Peru, Singapore, the Republic of Korea, Turkey, and the UAE. Since this is the first time that our group is officially addressing a WHO governing body meeting, I wish to briefly highlight why we deemed it necessary to form this group. G4IDR was launched on the occasion of the 73rd World Health Assembly in May this year as an action-oriented group of like-minded countries that are willing to contribute to improving global response and preparedness against infectious diseases, including COVID-19, based on the lessons learned from the current and past health emergencies. As a collective, G4IDR intends to mobilize its strategic advantage as a Geneva-based group, working with WHO and other relevant partners to explore the ways to support them in the face of current and future challenges arising from infectious diseases. At this preliminary state, the topics of interest of G4IDR will include, but not be limited to the following: advocating multilateral efforts in global health governance, supporting WHO and other health organizations to be well equipped, constructively engaging in the global discourse on improving and implementing the international health regulations, advocating for fair, equitable, and affordable access to quality tests, treatments, and vaccines, sharing experiences and best practices from various divisions in different topics. For example, different approaches to improve urban health emergency preparedness and how to maintaining the routine immunization services to avoid another outbreak of other existing diseases in the midst of the pandemic, as well as sharing lessons learned in the COVID-19 response, and promoting commitment to minimize disruptions in cross-border trade, movement of people, and global supply chains of essential medicine and supplies necessary to prevent or mount an effective response to infectious disease. As for concrete actions, we intend to present joint positions whenever relevant, and also organize joint activities such as roundtables or webinars to discuss, raise awareness, and exchange best practices on the subject of common interest. Let me conclude by emphasizing that all activities of G4IDR will be operated openly and transparently, taking regional balance into special account. In this regard, I extend an open invitation to all countries who share these common aspirations to join the group. The G4IDR members wish to thank the Director General for convening this meeting. We also wish to appreciate the co-chairs of the IPR, as well as the chair of the IHR Review Committee and I hope and wish you all fruitful deliberations during this session. I thank you very much, Mr. Chair.
Thank you, Ambassador Lim from the Republic of Korea. I shall now invite Australia to take the floor. Thank you.
Many thanks and good evening to all. I congratulate the IPPR co-chairs and panel members on their appointments to lead this important work. Australia appreciates the report on progress as well as the updates provided by the IOAC and the IHR Review Committee. The COVID-19 pandemic has driven home the need for international cooperation. It's a powerful reminder of the importance of strong global systems that respond collectively to problems that cannot be solved by countries acting alone. Importantly, health is also local and specific, which is why in the Indo-Pacific, Australia supports the development and implementation of specific actions to combat this crisis and strengthen health systems. The independent evaluation process provides a unique opportunity to address gaps in pandemic prevention, preparedness and response. We strongly encourage evidence-based and ambitious recommendations to strengthen the WHO's ability to prevent, mitigate and respond to future pandemics. We support the IPPR's terms of reference in line with the COVID-19 response resolution and welcome the strong focus on transparency, impartiality, independence, reliance on expertise and evidence, and a commitment to engage member states and others. Coming out of this process, Australia wants to see a more independent and authoritative WHO with strengthened implementation of the IHR, including robust monitoring and evaluation mechanisms. In this regard, the Human Rights Council Universal Periodic Review process may provide a useful model. Increased transparency of emergency committee deliberations should also be considered. We want to build a WHO which has stronger alignment across the global, regional and country levels with the capability to respond to health emergencies on the ground. We support ensuring the WHO Health Emergencies Program has wide, appropriate functions supported by sustainable financing. In addition, it's essential that we reduce the risk of disease transmission from animals to humans and further implement the One Health approach globally and locally. We reiterate our call to the IPPR to make clear and practical recommendations, setting a clear path for implementation at the World Health Assembly next year. And we encourage close engagement with WHO's member states in the evaluation process. We are heartened by the co-chair's presentation in this regard. We welcome further consideration of how Executive Board can engage more strategically in the review process. A number of valuable proposals and contributions have already been shared, and we look forward to discussing how to progress these, especially in areas where action can begin now. Looking ahead, we believe that the Executive Board has a critical role to play in shaping and driving implementation of the evaluation findings. Australia stands ready to assist this work and to contribute to all and any opportunities for exchange and dialogue. We are also ready to provide national input, including a submission as was invited tonight. This will be informed by our domestic experience and lessons learned. Thank you.
Thank you very much to Ms. Edwards from Australia. I should now invite Singapore to take the floor, to be followed by the United States, China, and then Oman. Thank you. The floor is yours.
Mr. Chairman, colleagues, there are lessons to be learned from every emergency response and every country's experience with this pandemic. Singapore expresses our appreciation and support for the important and challenging work of the IPPR, the IHR Review Committee, and the IOAC in this perfect storm of challenge and complexity. At the same time, it is a delicate balance for the WHO to coordinate and support the international efforts responding to COVID-19 while these three committees are undertaking their work. We appreciate the DG's assurance that WHO would be an open book to support the various committees' work. On the IPPR, Singapore agrees that its focus should be on finding the facts making recommendations for the ongoing pandemic, and laying the foundations to strengthen global preparedness for the next pandemic. The inquiry's primary focus ought to be on the WHO, but should also include the role of other partners, stakeholders, as well as member states. We are all part of the international health response to COVID-19. We wish the distinguished co-chairs and IPPR members success in their work, and Singapore stands ready to support their mandate. Now, it's critical that member states are involved and invested in the IHR review process, as the international health regulations will only be as strong as the commitment of the member states to embrace its mandate and fulfill their obligations. We note that the IHR Review Committee is actively seeking inputs in its open meetings, and this is welcome. Singapore will provide our inputs. For the IOAC's interim report, we agree that it may be opportune to reassess the role of the WHO in issuing travel advisories during a pandemic, given that any mandate to or not to do so needs to have the buy-in of WHO member states. Now, as a core member of the G4IDR, the Support Group for Infectious Disease Response, Singapore shares the commitment to work with the WHO and member states for a safer world, where our collective interest lies in improving the global capacity to prevent, respond to, and overcome pandemics. Thank you.
Thank you, Singapore. I shall now invite the United States to take the floor. Ms. Burr, thank you.
Honorable Minister, fellow members of the Executive Board, WHO members of the World Health adopted Resolution WHA 73.1, calling for a, quote, stepwise process of independent and comprehensive evaluation, including using existing mechanisms appropriate to review gained and lessons learned coordinated health response. Member states overwhelmingly supported this resolution because we all want to understand what happened, how it happened, what happened. We can all better the community facing such a pandemic. Millions have been impacted by COVID-19, some losing loved ones, many losing their jobs, and now we are all facing unprecedented health and economic challenges. Of confidence in key institutions like nothing we have experienced in our lifetimes. The United States willingness of the co-chairs, former Prime Minister of New Zealand and former President of Liberia, Ellen Johnson Sirleaf, to lead the panel. We appreciate and support the organized and clear process described by the co-chairs. However, we feel it is important for IPPR to provide findings preliminary, well in advance of the 74th World Health Assembly, so that member states can develop and find consensus on governance and other necessary strengthening mechanisms to ensure the WHO's toolkit is up to date and fit for purpose. I also request that members of the Executive Board be briefed this November and again in early January 2021, prior to the Executive Board meetings, so that we can engage in substantive discussions on how best to address the challenges and issues identified by the IPPR. We appreciate the progress made by the IPPR to date and are reassured by the confirmation that the IHR Review Committee and the IOAC are coordinating and collaborating. Finally, I would like to take a moment to applaud the Pan American Health Organization, PAHO, for taking steps in collaboration with member states to strengthen its governance and the oversight role of its governing bodies. PAHO worked with its member states to craft governance strengthening measures designed to increase transparency, impartiality, and mitigate risks to PAHO. I greatly appreciate Dr. Etienne's leadership and see PAHO's efforts as instructive for the IPPR and WHO. The United States looks forward to its findings and recommendations, and we appreciate of its members. Thank you.
Thank you very much to Admiral Goria from the United States. I shall now invite China to take the floor. Thank you.
Thank you, Mr. Chair. The Chinese delegation thanks the IPPR co-chair, the chair of IHR Review Committee, and the chair of IOAC for the latest information, and thanks the WHO Secretariat for initiating the establishment of IPPR in a short time, and making sure the existing WHO mechanisms such as IHR Review Committee and IOC. China has taken note of the personal position, job responsibility as work plan issued by the IPPR co-chair, and appreciates the open and transparent work, and appreciates the IPPR co-chair still give full consideration to the principles of professional fields, geographic areas, and gender balance as much as possible despite the limited number of members. We also take note of the first major report issued by the IHR Review Committee and express concern about the challenges faced by the WHO in terms of functional authorization and financing. We are concerned that the IOAC interim report. We hope that the Secretariat can further improve the index system and methods for evaluating the core competence, so that the international community can take more targeted measures to further support countries with weak health systems to improve their ability. China calls on IPPR, IHR, and IOAC to further enhance transparency, inform member states of their work in a timely manner, and use the platforms to enhance interaction with member states, and to inform them with reports that's reliable and convincing. Thank you very much.
Thank you very much, China. And I shall now call upon Oman, to be followed by Tonga, the United Kingdom, and then to India. Thank you.
Excellencies, I would like to start by thanking the co-chairs of the IPPR, the chair of IHR Review Committee, and the chair of the IOAC for their excellent presentations, and I assure them our full cooperation and support in their endeavor. The Sultanate of Oman would like to make a joint statement together with Botswana, Nepal, and Switzerland on behalf of the Coalition for a Universal Health Protection Architecture. The COVID-19 crisis emphasized the need for a coherent and a coordinated universal approach to health protection, ensuring a defined global architecture for universal health security that is legitimate to all. Therefore, the ministers of health of Botswana, Nepal, Switzerland, and Oman on 23rd of June launched virtually the Coalition for Universal Health Protection Architecture, committing them to act jointly as champions in their respective WHO regions. The coalition aims to support the WHO leadership in its leadership role and to reaffirm the importance of multilateral cooperation and engagement towards the universal health protection architecture. As coordinated approach are particularly important at times of crisis, and multilateralism is at the heart of this common endeavor. We are presently examining concrete elements for a joint position of the coalition. We hope that our work can support in the future ongoing efforts and evaluation process by the IPPR, the IHR Review Committee, and the IOAC. Thank you very much.
Thank you to Oman, and now to Tonga.
Honorable Chair, WHO Director General, Your Excellencies, On behalf of the Kingdom of Tonga, I would like to make this intervention. First of all, I would like to commend the high quality work that has been reported by the chairs of the three committees. I understand the diverse and rich and very comprehensive presentation and approach that has been taken. However, I am also concerned in regards to recommendations that has been stated to be practical because of the situation in the Pacific. In that, I am considering the micro population of the Pacific and very weak healthcare system. I understand that the recommendations to be made will be an approach at the global stage that will appear to be a one-size-fits-all, but judgment on the ground during this pandemic have been very, very critical given the micro population of the Pacific. Some of the Pacific Islands are only of 10,000s and 100,000s. And I have stated in the past of the risk of eradication of a generation or eradication of a nation if the Pacific is not very quick to responding to the pandemic. So therefore, for me, it is very important that I propose inclusiveness of the Pacific into this committee to bring the perspective on the ground on a very weak healthcare system so that there is reach and complexity and relevancy of the recommendation from this review committee so that it can be practical on the ground on very low and very weak healthcare system. We understand that 14 of the countries and territories in the Pacific are still COVID-19 free. So therefore, there is value in this perspective for the global community. So I would encourage that we will engage the Pacific into the future, into committees to bring those very rich perspectives. I thank you very much, Honourable Chair.
Thank you very much to Tonga, recognizing the time difference and that it would be very early in the morning there. Thank you. We shall now move to the United Kingdom. Thank you.
Very much, and thank you to all of the chairs for their extremely helpful update. The UK is a
Apologies, United Kingdom. The sound does appear to be very weak. Please just bear with us a moment whilst we try and make an improvement to that. Thank you. May we kindly ask that you would commence the statement once again, and we hope that the sound might be better. Thank you.
Thank you. I'm just checking whether you can hear me all right now.
Our apologies, it does still sound slightly faint. Shall we? May we propose that we would move to the next speaker, whom would be India, and then we can try and come back to you. Should that be fine? Thank you. Thank you very much. We would now give the floor to India. The floor is yours. Thank you.
The Director General for appointing the co-chairs of the independent panel for pandemic preparedness and response, IPPR. India also congratulates Ms. Ellen Clark, the former Prime Minister of New Zealand, and Ms. Elena Johnson Sirleaf, the former President of Liberia, on their appointment as co-chairs and also other members of the IPPR. India hopes that under the leadership of the co-chairs, a comprehensive and independent assessment of the gaps and challenges in handling pandemic preparedness and response would be accomplished. Chair, India sincerely believes that in the context of a global pandemic like COVID-19, robust and resilient national health systems are important. But equally important is a robust, agile, and prompt WHO response. It is in this context that we feel that the independent panel has been entrusted with an important and complex task. This presents the panel with a unique opportunity to usher in far-reaching and creative reforms. Such reforms would eventually enhance the operational efficiency of pandemic response. The panel, we believe, would not only critically analyze the response to the pandemic, but would also point out the deficiencies of current structures as well as the existing gaps in pandemic preparedness and response. The Government of India is signatory to the International Health Regulation 2005. India updates contact information with respect to the IHR regularly. India is investing on a sustained basis to build and strengthen IHR core capacities. Chair, we note with satisfaction that the Independent Oversight and Advisory Committee for WHO Health Emergencies Program has not only submitted multiple reports, but has also conducted multiple field missions. We would be eager to know the specific follow-up actions initiated by WHO headquarters on the interim report on WHO's response to COVID-19 by IOAC. India is working towards strengthening a One Health approach in its national programs through implementation of intersectoral coordination between related departments like health, agriculture, animal husbandry, etc. I thank you again, Honorable Chair.
Thank you very much, India, for this statement. We shall now try and go back to the United Kingdom. Again, please bear with us. And then we shall proceed with Indonesia, Argentina, and Ghana. Thank you. Over to you again, United Kingdom.
Thank you very much, and I'm hoping that you can hear me well now.
I confirm we can. Please proceed.
Perfect. In that case, thank you to all of the chairs for their extremely helpful updates. The UK is supportive of the IPPR and was pleased to see its launch earlier this year. The value of beginning a review at this stage, while still in the middle of tackling the pandemic, is that we can learn from the response to date and use that knowledge to improve the next stages of the current pandemic. The priority for the IPPR should be recommendations on how we can work together to strengthen WHO and our collective ability to respond to outbreaks going forward. WHO has never been so visible and had so much support, but with this comes greater scrutiny and expectations. We have a narrow and closing window within which to identify and set in train the organisational and emergency reforms needed to make WHO the agile and modern organisation we need it to be. It's therefore essential that the outcomes of this review are comprehensive, credible and ambitious, capitalising on this current global appetite for action. For the review to be successful, it's also essential that these findings and recommendations are grounded in the latest and the best scientific evidence. Given the potentially unlimited amount of quantitative and qualitative information available to the panel, we believe a scientific advisory group would be a beneficial addition to your structure. It would ensure that the advice given to the co-chairs and the panel is fully independent and impartial, capturing the best evidence available. It would streamline and speed up the collection and analysis of evidence, enabling the development of a comprehensive base to inform your review's output. And it will provide the co-chairs and panel with consistent advice over the entire course of the review, covering the range of necessary technical expertise, including, for example, as mentioned by others, human health, animal health, behavioural science, organisational change modelling and forecasting. We'd welcome views from the co-chairs on this proposal and on your intended methodology for handling and prioritising the information that you highlighted will come from a wide range of sources. The UK will continue to engage with the panel, including through the open call for member state contributions mentioned in this presentation. And we were very pleased to hear today how the IPPR co-chairs will coordinate with counterparts from the IOAC and the IHR Review Committee. We look forward to a cohesive set of interim reports in November and January and final reports in May. And to conclude, we remain committed to support the process and will do everything we can to support you in your extremely important work. Thank you.
Thank you very much to the United Kingdom, and we shall now give the floor to Indonesia, followed by Argentina and Ghana. Thank you.
Thank you. Honorable Chair, Excellency, and distinguished delegates. Since the start of the pandemic, there has been numerous debates on the effectiveness of the current global health sector in responding to health emergency. The current pandemic has once again exposed our vulnerability in dealing with emerging infectious disease. In this regard, the call to evaluate the existing international framework should be directed purely to create a more robust global response to the ongoing pandemic as well as future health emergency. We therefore, is it clear my voice?
Yes, I confirm we can hear you. Please proceed. Thank you.
Yeah. We therefore welcome the work of the IPPR, the Review Committee of the IHR, also the Independent Oversight and Advisory Committee for the WHO Health Emergency Program, and to thank them to their interim reports. Indeed, we should continue our effort to harmonize and synergize collaboration among the three mechanisms. This will enable their work in providing a more effective and comprehensive recommendation. Through this transparent, inclusive, and cohesive approach, we are confident that their work should ensure a robust result. In doing so, I would like to highlight the following point. Firstly, on the issue of determining stages of the health emergency, Indonesia delegation viewed that a stepwise approach involving different levels of warning should be considered as a means to strengthen overall early warning system of health emergency. Secondly, lessons learned derived from COVID-19 and previous pandemic should be the basis in providing solutions to pave the way forward. Recommendations should look into strategies or best practice that have been done that would enable government and other stakeholders to not only save lives, protect livelihoods, but also promote development. Lastly, we need to strengthen the mechanism that safeguard the continued implementation of other essential health services during health emergency. Mr. Chair, as we are fighting against COVID-19 pandemic, we must keep in mind that more effective multilateral cooperation across the world is becoming increasingly critical. Global Health Security Agenda, GHSA, in this regard, has been playing an important role in accelerating the implementation of the IHR. So GHSA was designed to serve a platform of collaboration among member countries and stakeholders to achieve the vision of world safe and secure from global health threats posed by infectious disease. GHSA consistently promotes multi-sectoral engagement, emphasizing global health security as national priority and galvanizing high-level commitment to global health security. In this context, Indonesia delegation is on the view that the work of three mechanisms include taking into account the contribution of the existing global health security agenda and possible future framework to have a more robust response to future health emergency. I thank you, Chair.
Thank you, Indonesia. And now to Argentina.
Gracias, señor presidente.
Thank you, Chair. We would like to thank the Director General for creating the IPPR on the international health response to COVID-19, and we'd also like to thank the co-chairs of the group for the presentation of the report on their initial work. We would like to repeat the commitment of Argentina to implement IHR 2005 in order to develop and maintain basic capacities and integrate it into our national health system. Argentina recognizes that transparency and development is essential for the implementation as a legally binding tool, and so we will present the annual report for the Assembly, and we are working on our national action plan for 2020-24. In relation to the documents for guidance, technical guidance and instruments for COVID-19, we are most grateful for the publications that the WHO has produced, and in particular the work that we've had from PAHO. Argentina has participated in the open meeting on the IHR Review Committee for COVID-19, and we hope there will be more open meetings for all member states in the future. We understand that the final selection of the members of the IPPR was based on skills, knowledge of the international system, and experience in international processes. And however, we hope that experts proposed by member states will be able to participate actively in this process since it's so important. COVID-19 will not be the last health emergency that the world will suffer from, so it makes it extremely important and urgent that we work with these three bodies. As our Minister of Health said to the PAHO Directive Committee, this battle will only be won if we work together. Thank you.
Thank you very much, Argentina. And next shall be Ghana, to be followed by the Russian Federation, Kenya, and Grenada. Thank you. And now to you, Ghana.
Thank you very much. Mr. Chair, Ghana is honored to deliver this statement on behalf of the 47 member states of the WHO Africa region. We thank the co-chairs of the Independent Panel for Pandemic Preparedness and Response, the chair of the Review Committee on the Functioning of the International Health Regulations, and the chair of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program for their updates. We commend the Director General for convening the special session, which provides an avenue for stock-taking on the successes and shortcomings in the global response to COVID-19 pandemic, and to chart a common positive path towards the pandemic recovery phase and beyond. We congratulate the chairs and members of the respective committees on their appointments and wish them success in their important assignments. The breadth of skills and expertise of the members persuade us of their capacity to deliver on the important tasks ahead. It is still too early to ascertain the full impact of COVID-19 on Africa. Nevertheless, the continent has fared much better thus far, contrary to many of the predictions made at the beginning of the pandemic. The results so far has been mixed, with various causes for concern, but also opportunities for hope and demonstration of the resilience of the African spirit. With the support of WHO Regional Office, the African Union acted swiftly and endorsed a joint continental strategy in February, which has proved instrumental in complementing efforts by member states in the COVID-19 response. Chair, regarding the work of the IPPR, Africa wishes to see closer and more meaningful engagement with member states for the success of the process. In this regard, we urge the team to provide ample opportunity for inputs by low and middle income countries, as well as small island developing states, and to reflect the experiences and realities of these states in the outcome document, as these regions bear the greatest burden of public health and other emergencies. We call on the panels to remain focused and limit their work to the provisions of Resolution WHO 73.1 and resist the temptation of veering off too far from the mandate of the resolution. In this regard, we find the 3 themes outlined in the IPPR's program of work too expansive. It is our view that the themes, as currently stated, exceed the scope envisaged in Resolution WHO 73.1. They should be re-examined to bring them within the confines of the resolution. We further call on the IOAC to include its final report an assessment of the skills mix and the diversity of the human resource workforce of the Health Emergencies Program, in addition to documenting the successes and shortcomings of the COVID-19 supply chain consortium so as to enhance WHO's operational capacity. In conclusion, the African member states hereby reiterate their full support for the respective committees, while calling on them to be inclusive and leave no member state behind in the process of reflection and learning. We look forward to receiving further updates and progress reports as the review processes unfold, so we can make such inputs into the outcome documents before their eventual submission to the 74th World Health Assembly in May 2021. I thank you for your attention.
Thank you very much, Ghana. And now to the Russian Federation.
Chair, Director General, colleagues, we are grateful for this interim report submitted to the EP on assessing the work that has been done by the IPPR, the IHR Review Committee, and others who've been involved in assessing all that has been done within the WHO, particularly within the framework of the HEP. We note the importance of the fundamental resolution WHA 73.1 that was adopted at the WHA this year. This resolution instructed the DG in harmony with member states to undertake a process that would be transparent, independent and fully integrated in terms of assessing the work done on COVID response. We would like to emphasize the fact that the procedure to be followed is one that is recognized internationally. And the Russian Federation therefore believes that when it comes to assessing the measures taken to combat the pandemic, we must always act in accordance with internationally recognized standards and principles as laid down in WHA 73.1. When it comes to taking key decisions relating to the way in which this assessment can be conducted, it's important that we take due account of views put forward by member states. And it is clear then that we have to look in particular at the role played by certain bodies within this organization, the IPPR, as well as the 2 mandated bodies. We have to look carefully at the way in which they operate, their terms of reference, and the way in which they are going to achieve certain results and outcomes. As we see it, it's important to take a balanced approach. And sadly, within the IPPR at present, we do not see a balanced report because a balanced situation, because there is one whole geographical region that is not represented at all. And if you consider the fact that this region represents a very significant proportion of the world's population, that is a serious imbalance. We have to recognize that the composition and membership of such a body should have been achieved through consultations with all, broad-based international consultation, and it would appear that the way in which this was done was not fully in line with that kind of approach. The terms of reference, as we see it, do not take account of some of the very important issues that we, for instance, would have liked to have seen respected. We therefore believe that we need to look again at the TORs for the IPPR, and they need to be reconsidered before being endorsed by member states. We need to have expert involvement also, technical experts who can be involved with this if it is to do the job it has been given. We think that is the kind of approach that could assist us in moving forward so that no one could doubt the impartiality and the professionalism of the panel. Thank you.
Thank you, Russia. And now to Kenya.
Thank you, Chairperson. Kenya aligns our statement with that delivered by Ghana on behalf of the African member states, and that delivered by the Republic of Korea on behalf of the G4IDR group. Kenya welcomes the updates provided by the co-chairs of the Independent Panel for Pandemic Preparedness and the chairs of the IHR Review Committee on COVID-19 and the chair of the IOAC on the progress made in the respective areas of work. The government of Kenya recognizes that a resilient, stable, and sustainable health system through health security is a prerequisite for the realization of the nation's universal health coverage agenda. Although the country has made progress in recent years, the 2017 joint external evaluation of the IHR revealed significant gaps which the government is systematically addressing through the Kenya National Action Plan for Health Security. This approach has proven to be extremely useful as we continue to respond to the COVID-19 pandemic. Chairperson, the global response to the COVID-19 pandemic has laid bare weaknesses and major challenges in the international approach to managing public health emergencies. Looking ahead, Kenya requests for increased international assistance to low and middle income countries to build core IHR capacities through training and capacity development, as well as support for surveillance, reporting and pandemic simulation and response initiatives. We also recommend strengthening of the capacity of the IHR emergency committees, especially with respect to the decisions to declare a public health emergency of international concern, including recommendations of travel and trade measures. We urge the Director General to ensure that they are adequately resourced in order for WHO to discharge its mandate effectively and within the prescribed time frame. We request the Director General to keep the Executive Board and Member States updated on their progress and to work within the scope of their respective terms of reference in alignment with the COVID-19 resolution and evaluation objectives. In conclusion, Chairperson, the Government of Kenya reiterates support for the IPPR, IHR Review Committee, and the IOAC, and thank the respective members for their willingness to serve humanity in this role. I thank you all.
Thank you very much, Kenya. I shall now give the floor to Grenada, to be followed by Bangladesh and then Botswana. Thank you. Grenada, we would just wish to confirm that you would still be in a position to take the floor.
Grenada congratulates and thanks the DG and the co-chairs of the Independent Panel of Pandemic Preparedness and Response and the chair of the Review Committee of Functioning of the International Health Regulations, the chair of the Independent Oversight Advisory Committee for the WHO. We look forward to regular updates and pledge to report to the committees as is mandated. We believe that Grenada, like other Caribbean nations, have unique vulnerabilities and stories as small island developing states, particularly considering the pandemic threat in conjunction with the climatic challenges of seasonal hurricanes. As such, we look forward to a more active role for SIDS in the committee. We believe to date, the Director General and the committees have been extremely transparent in their approach, and our commitment to this transparency can be counted on. As nations of this beautiful world, we are only as strong as our weakest link. The one lesson for sure is that we are all in this together. We look forward to regular, timely briefings to the Executive Board and a way to include the story and preparedness of small island developing states. In closing, I would like to commend Dr. Etienne and the Pan American Health Organization for the invaluable support we have received and continue to receive in responding to this new threat, as well as to all other public health challenges that exist in our world. We pledge our continued support to PAHO, the WHO, and the committees reporting today. Thank you.
Thank you, Grenada. And now to Bangladesh.
Thank you, Madam Chair. Madam Chair, ladies and gentlemen, the establishment of the Independent Panel for Pandemic Preparedness and Response to COVID-19 is one of the key outcomes of the May resolution of WHO, which we supported wholeheartedly. We would like to congratulate the co-chairs and other members of the Independent Panel on their appointment. We hope that the panel would be able to conduct an impartial, independent, and comprehensive evaluation highlighting mainly the WHO coordinated international health response to COVID-19. Madam Chair, at this stage, I wish to make 3 specific points. First, the independent panel should give special focus on WHO's contribution made so far to lower and middle income countries in response to the pandemic. It would also be crucial to reflect WHO's action taken in strengthening health systems and ensuring health and well-being of the peoples of those countries in the context of COVID-19. Second, the panel should clearly find out the existing gaps and challenges faced by the countries in addressing the pandemic. Again, particular focus should be given to the vulnerable countries and countries with weaker health systems. And third, the panel should come up with the recommendations not only to improve capacity for global pandemic preparedness, prevention, and response, but also to effectively contribute to the area of early detection of any potential pandemic in the future. At the end, I wish the IEPPR full success in their upcoming endeavors. Thank you, Madam.
Thank you, Bangladesh. I should now invite Botswana to take the floor.
Thank you, Chairperson. Botswana aligns with the statement made by Ghana on behalf of African countries. We thank the co-chairs for the interim reports. We congratulate and are confident that the diversity of the 11 nominated members of the committee will provide the needed experience to the evaluation processes and the recommendations thereof. I also wish to thank the chair of the HR Review Committee and the chair of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program for their progress update. We welcome the committee chair's report that they are working to avoid duplication and leverage from each other's work. The COVID-19 pandemic offers the opportunity to build on the successes of past disease outbreaks such as influenza pandemic and Ebola virus outbreak, and to further strengthen the existing WHO Health Emergencies Program. In this regard, allow me, Chair, to reiterate the message that was delivered by the distinguished permanent representative of Sultanate of Oman on behalf of the members of the Coalition for a Universal Health Protection Initiative. Now, more than ever, we need to support the WHO's central role and leadership role to advance global health security through building strong and resilient public health services systems that can prevent, detect, and respond to infectious disease threats. The IPPR should maintain independence and impartiality, and there's a need to ensure that processes of the committee are as transparent as possible. Chair, member states' consultations and engagements about all the ongoing processes is paramount. Lastly, we wish to reaffirm Botswana's commitment to work and partner with the international community in the global response, as well as rally support for a multilateral approach to controlling the pandemic. I thank you.
Thank you very much, Botswana. And it is now with great pleasure that we would hand back to Mr. Chair, to Dr. Harsh Vardhan. Thank you. The floor is yours.
I understand Chile present in the EB room wants to take the floor. Chile, you can have the floor, please.
Gracias, señor presidente.
Thank you, Chair. I want to thank the committee for its work, as well as that of the independent committee, as was presented in the reports. We would like the reports that stem from these bodies to be practical. They need to tell us about tools that can improve states' ability to manage global health emergencies. Similarly, we value what was raised by Germany on behalf of the European Union, Austria, and other delegations with respect to setting up a review mechanism similar to UPR with an intermediate level for raising alerts. These ideas have also been raised by my country together with Bolivia, Uruguay, and others, and it has been presented for examination to the IPPR and the DG, together with other suggestions, and we also believe we need to go further with the different measures suggested. We need to focus on the most vulnerable groups that have been affected by this pandemic. Thank you very much.
Once again, I would like to request the Secretariat to moderate the discussion further. Secretariat, you can have the floor.
Thank you very much, Mr. Chair, Dr. Harsh Vardhan. I understand we have one more EB member who would wish to take the floor, that being Sudan, and then we shall move to other member states. Sudan, the floor is yours. Thank you.
Thank you, Chair. Honorable Chair, distinguished delegates, excellencies. Sudan welcomes the update from the Independent Panel for Pandemic Preparedness and Response, the Review Committee on the Functioning of the International Health Regulations 2005. During the COVID-19 response during the COVID-19 response and the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program, noting the vast effects of the pandemic, not only on the healthcare system, but on all facets influencing humankind, the Republic of Sudan has built its response strategy on a whole-of-government approach, engaging all sectors to appropriately addressing COVID-19. The directing of all medical resources of all over the country to address COVID-19 may have strengthened our initial response to the pandemic, but in retrospect, it has also greatly hindered the routine essential healthcare services, supplies, and particularly human resources. Our current healthcare system, while in need of support in terms of community-based COVID-19 surveillance, tracing, and tracking, it must also be strengthened and reinforced in order to withstand and combat the concurrent polio outbreak, as well as the recent floods. The collateral impact of the COVID-19 on all aspects sheds light on the critical need for the international community to provide holistic and speedy support to the developing countries in their efforts to tackle COVID-19, in addition to the steady strengthening of the capacity of the public health system and a pressing overall need for a
Our apologies, Sudan.
highlights the importance and calls on the international community to adopt a flexible funding strategy to rapidly tackle both COVID-19 obstacles as well as maintaining essential health services. Healthcare systems must be prepared, especially those for vulnerable countries, in terms of gaining access to COVID-19 tools. ACT Accelerator, sharing updated scientific data, coordinating international efforts to attenuate the re-emergence of COVID-19 and effective vaccine development in order to undertake this complex health and development crisis. We call on member states and WHO to share best practices from this pandemic to ensure efficient approaches are used to tackle COVID-19, as well as to allow for a more prepared health system for future health emergencies. We here like to reiterate Dr. Tedros's words of solidarity, solidarity, solidarity. Thank you, Chair.
Thank you very much, Sudan, for this statement. We understand that we have an additional EB member who would wish to take the floor, that being Finland. If we may now give the floor to Finland and to be followed by those member states not represented on the board. Thank you, and Finland, you have the floor.
Thank you, Honourable Chair, Director General, Your Excellencies, delegates. Finland aligns herself with the statement made on behalf of the European Union and its member states. Finland thanks the co-chairs of the IPPR and the chairs of the IHR Review Committee, the Independent Oversight and Advisory Committee, for the updates. We also take note of the report of the Global Preparedness Monitoring Board as a relevant contribution to this process. We see value in hearing reports from the different groups at the same session. We expect that this dialogue and exchange of information between the groups will continue in order to ensure a sensible division of labor and avoidance of duplication of efforts. We support the independent and impartial nature of the IPPR. At the same time, we wish to underline that the wording of the resolution calls for consultation during the process. In our view, it is important that the panel takes a comprehensive approach and looks at the roles and actions of all relevant actors. We could also like to thank the IOAC for their invaluable insights into the WHO Health Emergencies Programme. The IHR Review Committee has the benefit of studying the recommendations of its predecessors. One of the key questions is, how can we make sure that the recommendations get actually implemented? The current pandemic may also put into new light issues that have previously seemed impossible or difficult. Furthermore, we would like to highlight the many relevant ideas identified this February in the Executive Board resolution on preparedness and IHR implementation as a starting point. It is important that we take the lessons learned and apply them on existing mechanisms. For example, the joint external evaluation process has marked an important shift in understanding how we can systematically build preparedness. Developing the next version of the JEE tool will further help countries to evaluate their strengths and weaknesses with the aim of building a better system. Another lesson that has come across very clearly is that health is a political choice. Going forward, we need an economy of well-being that strengthens the society and supports green economy, increases well-being, and improves our resilience to future crises. Thank you.
Thank you very much to Finland. And we shall now move to a video statement by Colombia, technology prevailing. Thank you.
Gracias, señor presidente.
Thank you, Chair. We take due note of the reports presented and we recognize WHO's availability to kick off the impartial and exhaustive review process of the international sanitary response coordinated by WHO. We applaud the creation of this independent IPPR, and we congratulate their co-chairs and all their members on their nominations. We wish to recognize the important work to be carried out by this group. This work will be absolutely essential to identify the challenges that are ahead of us, and they will also help us to draw up a roadmap to improve our prevention, preparation, and responsibility in the face of emergencies. That is why Colombia is completely present to support the process, compiling different lessons learned we've had at the national level, not only bearing in mind the current emergency, but also more recent processes that have challenged us, such as the migratory phenomenon. We applaud the fact that the working group will bear in mind the participation and inputs of member states, and we have full faith that this participatory approach will lead to concrete recommendations with texts that are based on technical know-how and the global context, and above all will allow us to help in its implementation down the road. At a global level, we have a consensus on the need to implement strongly IHR and our response to emergencies. The role of WHO is absolutely essential in this process, and it is so recognized. That is why we want to emphasize the need to redouble the importance and availability of technical assistance in accordance with the IHR, and to reaffirm our commitments, both national and international, with this essential instrument for the protection of public health. We need to maintain the basic capacities of our different countries, timely communication, exchange of information, double-checking in case of potential emergencies, proportionality of measures adopted, among other things, are some of the major challenges that we need to face in the context of epidemiological surveillance, and it's important to address these as quickly and effectively as possible. Without a doubt, this pandemic has laid bare the fact that countries need to work together, showing solidarity under the technical leadership of WHO. We need to work in a strong fashion to support our national health systems. We have complete faith that the lessons learned from this emergency will allow us to move forward towards that grand objective, and that they will make us stronger thanks to the lessons learned in this context. Thank you very much.
Thank you very much to Colombia, and we shall now move to those member states not represented on the board, recognizing Thailand, Belgium, and Brazil with their hands up. I shall now give the floor to Thailand. Thank you.
Thank you, Chair. COVID-19 pandemic has revealed the huge potential of the community and non-state actors in responding to outbreaks, epidemic and pandemic, which is not reflected in the current IHR. Thailand would like to raise 3 points to all 3 committees. First, consider replacing the binary PHEIC architecture with an incremental mechanism that would enable intermediate stages for IHR-based alerts, guidance, and actions. Second, consider exercising and creating conflict resolution instruments like the Article 56 of the IHR that allows for the multilateral dispute resolution processes, including consultation forums among concerned states. Third, ensure the involvement of the horizontal community and non-state partners into the vertical state-only IHR systems to create an interwoven social fabric for stronger disease surveillance systems. Chair, the 2003 SARS pandemic expedited the revision of the previous IHR to get this 2005 version. Our great experiences from COVID-19, right or wrong, would allow us to further improve the IHR 2005 and its implementation. We do need a radically new manner of thinking on our IHR, and if we are to survive the future pandemic. Thank you, Chair.
Thank you very much, Thailand. We shall now give the floor to Belgium, to be followed by Brazil. Thank you.
Mr. Chair, Director General, Belgium fully aligns itself to the statements made by Germany on behalf of the EU and its member states. As many others, Belgium too wishes to express our sincere thanks to WHO, to Dr. Tedros, and especially to the entire WHO staff who has been working tirelessly for months now to fight the COVID-19 pandemic. We are most impressed by all work done, and especially by the completely new set of initiatives that saw daylight since the outbreak of COVID-19. Never before has WHO moved and transformed so fast. Yet there are many questions which need answers. Thus, the different review initiatives are highly welcome. Dear chairs of the IHR Review Committee and the IPPR, the reviews you will be leading in the upcoming months will be essential in defining how we can make our world a safer place. Therefore, we insist, firstly, on the importance of a thorough independent evaluation without cutting any corners in search of quick results. Secondly, on the importance to consult sufficiently diverse voices. And thirdly, on the importance to sticking to the pure facts at all times. In this context, and in order to enhance transparency and engagement, we have two questions to the IPPR panel. Firstly, we would suggest to focus also on the recommendations from the IHR Emergency Committee in January, and were these recommendations effective and justified, even considering what we knew at the end of January. And secondly, specific question, what budget is foreseen for these reviews, and is this sufficient in your view? We will further gladly accept the opportunity to submit a set of written comments to the IHR Review Committee. Lastly, to conclude on this occasion, we are also proud to mention the additional highly flexible contribution of 4 million euros that Belgium has mobilized to support WHO to strengthen health systems in fragile countries. Global health security is impossible in the absence of strong local health systems. I thank you for your attention.
Thank you very much, Belgium. And now to Brazil.
Brazil thanks Dr. Tedros, the reports and presentations by the co-chairs of the independent panel, the chair of the IHR Review Committee, and the chair of the IOAC. As a co-sponsor of Brazil is glad to see that the impartial, independent, and comprehensive evaluation we call for is taking shape. This is a process to be undertaken in consultation with members, as stated by the resolution. The more the member states are involved, the more various reviews and evaluations may have a concrete, meaningful, and positive impact. As is stressed by many that preceded me, this requires a high level of transparency and inclusiveness through the work by the panel, the review committee, and the IOAC. The effective implementation of and compliance with the international health regulations are essential conditions for an adequate response to national and international public health emergencies. Therefore, in our review exercise, we should seek better evaluation and monitoring mechanisms, as well as promoting international cooperation to enhance national capacities with regard to the IHR. The has been an opportunity for member states to give guidance on how the different processes could be properly coordinated among themselves and with intergovernmental discussions on WHO reform, avoiding duplications. Likewise, Brazil encourages the experts to offer views and recommendations
Our apologies, Brazil. We're unable to hear you. We'll just go back to you now so that you're able to finish your statement. Thank you. And thank you very much. We shall now move on to the next member states. And should Brazil wish to take the floor again, at the end we would kindly revert to Brazil. I understand that the next member state to take the floor would be Norway. Thank you. Norway, the floor is yours.
Thank you, Chair. Thank you also to the evaluation chairs for their updates. Norway is looking forward to reviewing their conclusions. Dr. Tedros, we commend your approach to the evaluations, that they should be met with humility. Every action we take should strengthen WHO's ability to fulfill its mandate. It should improve our collective ability to prevent and deal with crises, and it should improve our ability to deal with the crisis we are currently in. We appreciate the clear and constructive recommendations already made by the Independent Oversight and Advisory Committee. Norway supports revisiting parts of the IHR to ensure that it is an effective tool once the current crisis is sufficiently under control. We should also safeguard the DG's responsibility and ability to make evidence-based decisions without undue political influence in responding to crises, building on the technical expertise of the Emergency Committee and WHO staff. Lastly, we reiterate the need to invest in universal health coverage. Resilient health systems available to all would dramatically improve our chances of preventing outbreaks from becoming large-scale crises. Thank you.
Thank you very much to Norway. And next would be New Zealand, followed by Slovakia. New Zealand, you have the floor.
Thank you very much, Chair. New Zealand would like to thank the co-chairs of the Independent Panel for Pandemic Preparedness and Response for their report and presentation, and the chairs of the IHR Review Committee and the IOAC for their updates. As an early co-sponsor of Resolution 73.1, New Zealand is fully supportive of the various elements comprising the evaluations, and we thank those who have worked very hard on them. This year has fundamentally changed things for all of us. We must honour the victims of this pandemic by seizing the present opportunity to get this work underway so as not to find ourselves here again. We also wish to acknowledge Dr. Ryan's comments last evening, where he noted that when emergency response is needed, it will be easier where effective preparedness and country readiness measures are already in place. Much of our own focus domestically is still diverted to responding to the pandemic and its impacts on our people and economy. It will be a long journey to improve capacity for global pandemic prevention, preparedness and response. And we welcome this special session to share views and inform our thinking on how we might build back better. We consider that the voices of all member states will be important, and I want to support the statement made by our colleague from Tonga earlier in the session. It will be a long journey to but we are mindful that many countries, especially those who've been harder hit by the direct health impacts of COVID-19 or who are already experiencing capacity challenges before the pandemic may struggle to be able to contribute their views in this process of evaluation. So we appreciate the news today from the independent panel on the process for further member state input, and be interested to hear more from the co-chairs of the independent panel and from the chairs of the IHR Review Committee and the IOAC as to how they aim to ensure their work takes account of the experiences of the widest possible range of member states and situations, including those whose present domestic situations may pose challenges for their engagement in this process. Thank you.
Thank you very much, New Zealand. And we shall now give the floor to Slovakia.
Thank you, Chair. Slovakia would like to align itself to the EU statement delivered by Germany. We would like to draw your attention to at least 2 more points. Emphasis must be placed on the improvement of proper and unified complex data collection, both in the general population as well as in various communities and vulnerable groups in society for proper action, preparedness and response to COVID-19 in context of UHC and health for all. Moreover, we would like to support analysis in field of social determinants of health as important part of modern public health measurements, including areas such as mental health, palliative care, access, and psychosocial support as crucial part of the comprehensive care and essential evaluation of COVID-19 response. Information security platforms, diagnostic and clinical guidelines, and their quality recommendations based on rising evidence or good practice should not be ignored. Thank you.
Thank you very much, Slovakia. We understand that Canada would wish to take the floor. Over to you. Thank you. Apologies, Canada. We're unable to hear you at present. If you could kindly ensure that microphones are unmuted. Thank you. I'm afraid we're still unable to hear you. Please bear with us one moment whilst we just check with IT. Thank you so much.
All right. Thank you, Mr. Chair. Can you hear me now?
I confirm we can. Please proceed.
Thank you very much. Canada thanks the IPPR co-chairs and secretariat, the chair of the IHR Review Committee and the chair of the IOAC for these welcome updates. We are pleased to see this important work underway. Close collaboration between those 3 evaluation strands will be critical, and it would be useful to develop an overarching map on how these processes come together. We welcome the IPPR's commitment to independence, impartiality, and transparency, and regular engagement with member states. We look forward to receiving the program of work to have a more detailed understanding of how the IPPR will be taking its mandate forward. We appreciate that the panel will be both formative and forward-looking. The areas of inquiry are potentially vast. Priority should be given to those aspects that will have the biggest impact on strengthening the current response and preparing for future pandemics. Let me highlight a few areas of inquiry where we feel the panel and committees could bring value. First, how to better leverage WHO expert networks and resources to support the timely development, issuance, and uptake of WHO guidance, which is critical to inform evidence-based policies and programs to respond to pandemics. Second, how to enhance open and transparent information sharing within the global community in a timely fashion. Canada also supports a review of the WHO's role in providing travel and trade advice and an examination of the delinking such measures. Third, a strategic and operational review of the WHO's IHR monitoring and evaluation framework to ensure it is fit for purpose and continues to support IHR capacity building, as well as how to leverage synergies between strengthening IHR core capacities and health systems strengthening broadly. Finally, we call on the panel and committees to integrate the gender lens into their work and consider how we can achieve more gender-responsive outbreak preparedness and response. Thank you very much, Chair.
Thank you very much, Canada. Glad we were able to hear you there. We understand that Brazil would wish to take the floor again to finish her statement. Thank you. Brazil, you have the floor.
All right. Thank you, Madam Moderator. We are experiencing some internet connection problems here. I don't know where I stopped, so I will repeat everything. I'm sorry for those who will hear me again. But thank you very much for giving me the floor again. Brazil thanks Dr. Tedros, the reports and presentations by the co-chairs of the independent panel, the chair of the IHR Review Committee, and the chair of the IOAC. As co-sponsors of Resolution WHA 731, Brazil is glad to see that the impartial, independent, and comprehensive evaluation we called for is taking place. This is a process to be undertaken in consultations with members, as stated by the resolution itself. The more the member states are involved, the more various reviews and evaluations may have a concrete, meaningful, and positive impact. As stressed by many that preceded me, this requires a high level of transparency and inclusiveness throughout the work by the panel, the review committee, and the IOAC. The effective implementation of and compliance with the international health regulations are essential conditions for an adequate response to national and international public health emergencies. Therefore, in our review exercise, we should seek better evaluation and monitoring mechanisms, as well as promoting international cooperation to enhance national capacities with regard to the IHR. This EB special session has been very useful and a very good opportunity for member states to give guidance on how the different processes could be properly coordinated among themselves and with intergovernmental discussions on WHO reform, abiling duplications. Likewise, Brazil encourages the experts to offer views and recommendations fit to the implementation to be implemented by the member states and the WHO in a spirit of increased collaboration, transparency, and accountability. Finally, we'll be working so that Brazil comes forward with specific and concrete and constructive contributions to this exercise, as invited by the speakers and as a result of today's exchange. Thank you, Madam Moderator.
Thank you very much, Brazil. I wish to confirm that we're able to hear you very clearly. Thank you. We shall now give the floor to Mexico. Thank you. Mexico, confirming that you have the floor and would still be in a position to make a statement.
Muchas gracias.
Many thanks, Chair. Mexico wishes to recognize all the efforts made in the participants of this meeting, bearing in mind our different time slots. We are thankful for the information provided this morning from the three panels that will evaluate the response in the face of this humanitarian, economic, and sanitary crisis. The COVID-19 pandemic makes it clear that we need to work together to continue capacity building with respect to preparation, response, coordination, and communication in the face of emergencies. Similarly, we need to do the same to make WHO an effective body when it comes to coordinating international health matters. The diagnosis and recommendations that will stem from the three groups will depend in large measure and influence greatly the future measures we will take for coming emergencies, which is why Mexico would ask for the three groups to work in the following fashion. First of all, they should be complementary and help each other so they can carry out an ample diagnostic, taking advantage of the technical and political know-how of each one of these groups. Second, their results need to bear in mind the conclusions of previous evaluations that have identified important missed opportunities, such as those included in the Global Preparedness Monitoring Board and the organization reform process more broadly. Third, their analysis and conclusions need to be carried out with complete impartiality and transparency, and they need to present a practical roadmap to follow for member states and for the secretariat of the organization to be able to live up to the recommendations. This will facilitate a discussion regarding the future of the organization and how we will address health emergencies. Fourth, regarding the evaluation of living up to IHR commitments, we would suggest carry out a detailed impact assessment when it comes to the international coordination in our response, as well as the utility of drastic measures such as the total closure of borders and their real impact on the mitigation of the epidemic. Also bear in mind their negative impact with respect to human rights. We can have a good IHR, however, if it is approached, implemented in a piecemeal manner, that is not optimal. Mexico reiterates its commitment and makes an appeal for our approach to be based on human rights so that we can overcome this challenge, and we need to increase our global capacity so that we can face future challenges to global public health. Last but not least, we want to thank the effort and hard work of the conference interpreters that allow us to communicate in different languages. Many thanks to all.
Gracias, Mexico. And we shall now give the floor to Spain.
Yes, good afternoon. Do you hear me?
Yes, I confirm we can hear you.
Okay,
Thank you.
yes, thank you very much. It's my ambassador who will deliver the speech, so I kindly ask for another 5 minutes, if you can wait, please.
Thank you for informing us of this, Spain. It would appear that Spain is the last member state with their hand up at this stage. With the chair's permission, may I propose that we proceed with the video statement from Japan, and we shall then check back to see whether your ambassador would be in a position to deliver the statement. Thank you.
Thank you, Chair. We appreciate the work of the Secretariat and the co-chairs of the IPPR in taking the steps forward to review the WHO pandemic response in a fair, independent, and robust manner. We have 2 points to raise regarding the work of the IPPR. Firstly, while appreciating the wide scope of review, from health to socioeconomic impact of the pandemic, we must understand that meticulous review may be required for some important issues. In order for the report to amount to a significant action, we need to clarify such issues, the method of reviewing and the practical use of the outcome. Secondly, we want to highlight what the IPPR can achieve, in particular among other reviewing mechanisms. COVID-19 has exposed us to many unprecedented factors in global public health response, such as the sheer number of patients, including asymptomatic patients, a large-scale outbreak in a confined situation as in a cruise ship, the complex and multi-sectoral impact on the society, and the dynamic nature of international travel. On the other hand, we have also been equipped with unprecedented scale of the technology, allowing us to share information more rapidly than ever, accelerating the collaborated effort toward the development of diagnostic and treatment. We have also confirmed the importance of UHC, building sustainable, resilient health system, investing on human resources and other health infrastructures. Reflecting on such lessons learned, we expect the IPPR, together with the IOAC and the IHR Review Committee, can harness the challenges we faced with the existing mechanism and recommend practical way forward from comprehensive perspectives. The role of the IPPR in WHO reform is vital. We expect IPPR can reframe this global pandemic to an opportunity to review our pandemic preparedness and response in a fair, independent, and robust manner. Thank you, Chair.
Thank you very much, Japan. And we will now check whether the ambassador from Spain would be in a position to deliver the statement. Should it not be the case, we will proceed with Cuba. Spain, may you kindly confirm?
Sí. Sí, muy buenas tardes.
Yes, good afternoon. Spain supports fully the statement made by Germany on behalf of the European Union, and we would like to say the following on behalf of our country. The spirit of consensus which guided our resolution on COVID-19 in the last session of the World Health Assembly needs to guide us today in our work. Multilateral action, cooperation, and solidarity are the only viable options we have. To face this challenge, WHO has a central role and needs to be strengthened with a sustainable and predictable financial base. Spain, like other member states, has given great strides in that direction, made great strides in that direction, and in 2020 will increase both its volume and the flexibility of its contributions. The HEP needs to also be made stronger and provide emergency equipment when necessary. We need greater coordination and greater coherence in our health systems. WHO can contribute in this effort. A better implementation of IHR is absolutely essential. We approve of the recommendations made by the advisory committee, and they agree with our vision of things. For example, we should have new alert levels when it comes to emergency alerts for public health of international concern. WHO should also include visits to states. It's a moral imperative to provide access to vaccines, diagnostics, and medicines against COVID-19. As a founding member of ACT and part of its Facilitation Council, Spain shall spare no effort to that end. We want to thank the role of WHO as Secretariat for ACT. Spain believes in the One Health approach so that we can include the human, animal, and environmental dimensions because they're all interconnected, which is why we need greater cooperation, especially from FAO, OIE, and WHO. Last but not least, I will mention two Spanish initiatives that are particularly relevant. On the one side, we have an initiative on health and climate change, which WHO, Peru, and other countries presented in the Climate Action Summit 2019. And then we also have the initiative of Safe Sport that fits into the context of COVID as well as afterwards. Thank you very much.
Thank you very much, Spain. And we shall now give the floor to Cuba.
Señor Presidente,
Chair, many thanks for the different reports presented this morning by the three groups we heard from. We support the statements made by some countries regarding the work of the IPPR, regarding its lack of balance with respect to regional representation, as well as our technical concerns, which would have an incidence on its recommendations for how to address the pandemic. We need to bear in mind the current differences between countries of low and middle incomes, which have the more weaker health systems. This would be useful so that the recommendations made can strengthen their hand. We support a multilateral approach for all these measures and wish to reaffirm the need for transparency in the work of the organization. We consider that the IHR represents an extremely valuable tool for the implementation and response in the face of pandemics. However, we also believe that some principles need to be further defined. Among these include the following: a coordinated action that strengthens multilateral measures in the face of pandemics should be addressed more clearly when it comes to defining a public health emergency of international concern. We also need to look at the broad and global access to medicines, vaccines, and cross-cutting sectorial approaches and how this affects the economy. We're talking about the most important legal instrument we have at our disposal for public health. And to the extent that the review committee's recommendations will be implemented, it will have great consequences on global health. We want to reaffirm the values of cooperation and international solidarity, as well as broad agreement when it comes to implementing all its measures. Thank you very much.
Thank you very much to Cuba. And we have now reached the end of these statements by member states, in which case I have the great pleasure of handing back to Mr. Chair, Dr. Vardhan. Thank you.
Dear colleagues, we have made very significant progress today in the whole meeting. And as I understand, most of the presentations are now over. I propose that instead of having the scheduled break, we could continue with our deliberations till we finish the agenda. I understand you are all agreeable to it, and I give back the floor to the Secretariat to continue with the deliberations.
Thank you very much to Mr. Chair. I understand that we would now take any statements from observers or UN and other IGOs. I don't see any hands raised at this stage, in which case we would hand back to the Secretariat. Just give it a second here. Thank you, and I would now hand back to you. Thank you. To Mr. Chair. Thank you very much, Dr. Vardhan.
Thank you. I would now like to provide the opportunity for any additional comments by the co-chairs of the independent panel and the chairs of the IHR Review Committee and the Independent Oversight and Advisory Committee. Your Excellency, Ellen Johnson Sirleaf, you may have the floor, please.
Thank you. Thank you, Albert. This opportunity. Would like to thank all members. Excuse me.
Sorry, Your Excellency, Ellen Johnson Sirleaf, it doesn't appear that the sound is too clear at this stage. Please just give us a moment to look into that. Thank you. Thank you. We're just looking to rectify the sound for you, and in doing so, with the Chair's permission, we shall actually give the floor to Sweden. We understand we have an additional member state wishing to make a statement. So if you would seek your kind indulgence to now give the floor to Sweden, and we shall come back to you. Thank you very much.
Thank you, Chair. Sweden aligns itself with the statement made by the EU. We strongly support WHO in its crucial leadership in global health. To be better prepared for future health emergencies, we must learn from the COVID-19 response. We consider the ongoing reviews to be of great importance for the future, and we thank the co-chairs of the independent panel and the chairs of the IHR Review Committee and the Independent Oversight and Advisory Committee for the reports. Addressing global health challenges, including prevention, detection, and response to outbreaks, requires better implementation and compliance to the IHR. It also requires strengthening of global health security structures, including the WHO Health Emergency Programme. We know that measures implemented during the pandemic have socio-economic impacts that risk increasing existing health inequities and inequalities. Thus, it is important to evaluate the broader effects of COVID-19 on societies and public health, including mental health, domestic violence, elderly in isolation, adverse effects on children when closing schools, and reduced access to health services, including SRHR. We welcome the broader scope of the independent panel and encourage that its broad mandate is also used to evaluate the positive and negative impacts of the pandemic response. Further, that existing knowledge gaps are examined in order to determine what tools may be needed at country level to guide actions. Going forward, while focusing on increased global health security, we must not lose sight of WHO's important work to promote health and support member states to develop strong and resilient health systems that deliver high-quality services to those who need it, without leaving anyone behind. Thank you.
Thank you very much, Sweden. We shall now try to go back to our IPPR co-chair, to Her Excellency Ellen Johnson-Sirleaf. Thank you.
Thank you. We thank the Honorable Chair for this opportunity. We thank all member states for your support of the work of the independent panel, the IHR Review Committee, and the IOAC. We thank the chairs of the IHR Review Committee and IOAC for their presentations today. We note the call for complementary work of these bodies to produce a comprehensive report. We further note that this report must recognize gaps by nations and by WHO in preparation for the COVID-19 pandemic. We note the call for more technical and evidence-based inputs in our findings, and we look forward to working with all countries across the world and to draw on national expertise. We note and fully realize the call for regular and full consultation with member states. We share your concerns for the independent panel to produce a practical, robust, contextualized, and implementable report. This is our shared commitment, one that the independent panel takes seriously. We seek a healthier world together, and we must get there together. My co-chair, Right Honorable Helen Clark, and I look forward to working with all of you, to benefiting from your guidance, your inputs, and your suggestions. We all look forward to achieve a common objective as one world. Thank you, Mr. Chair.
Thank you very much, Your Excellency, and I should now hand back to Mr. Chair, Dr. Vardhan. Thank you.
Now let us turn to the chair of the IHR Review Committee. Dr. Wheeler, you can have the floor, please.
Um die Hälfte verkürzen oder so. Da müssen wir auch irgendwie mal einen Mechanismus finden. Wir nehmen das alle immer hin, auch diese ganzen Ethik-Stellungnahmen, dann diese Datenschutzfolgeabschätzung. Das bricht uns allen den Hals und das kostet uns so viel Kraft.
Yes, it would appear he would be perhaps on a call. I shall now hand back to Mr. Chair, to Dr. Vardhan again. Thank you.
As I understand, there is some disturbance in communicating with Wheeler. We can, in the meantime, give the floor to the chair of the Independent Oversight and Advisory Committee. Dr. Harvey, you can have the floor, please.
Thank you, Mr. Chairman, distinguished EB members and member states for your insightful comments and continued support. On behalf of Independent Oversight Advisory for WHO Health Emergency Program, I would like to our gratitude to member states for their appreciation of the interim report that we published today. And in particular, we thank Australia, Austria, Botswana, Finland, Indonesia, Kenya, Norway, Iran, Russia, Singapore, Sweden, and UK for their positive feedback. As alluded to by many of you today, WHO is composed of its member states and the organization's secretariat. Therefore, WHO is shaped by performance of both the secretariat and member states and their commitment to global health. We very much appreciate the actions of Austria and Germany on behalf of the European Union to tell the uncomfortable truth. We won't be shy to tell what is not going well, what we can learn from the past and mistakes, what needs to be done, and how we can improve collectively rather than by finger pointing. Moving forward, we appreciate concerns on how to ensure implementation of recommendations as clear by Austria, Cuba, and India. In this, for our next IOC to the resume in November, we intend to conclude our assessment on the WHE's progress with implementing IOC recommendations that we issued to the Director General over the past 4 years. Rest assured, IOC will continue exercising our responsibilities with full regard to the paramount importance of independence. We look forward to working with you, Member States, the IOC Secretariat, and other key stakeholders. Finally, IOC wishes to reiterate our commitment towards impartial, independent, and comprehensive evaluation, working together closely with the independent panel and the IOC committee in a cohesive and coordinated manner. I thank you.
Thank you very much to Dr. Harvey, the chair of the IOAC. Unfortunately, we weren't able to hear every word of your statement. However, we shall ask the Secretariat of the IOAC to ensure that your statement is made available. Thank you very much. And now back to Mr. Chair, to Dr. Vardhan. Thank you.
Thank you, Dr. Harvey. Now we can go back again to the chair of the IHR Review Committee, Dr. Wheeler. Dr. Wheeler, you can please have the floor.
Can you hear me? Yes, I know you can hear me. Thank you very much, Mr. Chair, for giving me the floor again. I just want to mention that there were various very helpful comments from the member states, and you can be assured that we take up all of those who directly are in the duties of the IHR Review Committee. What I particularly want to stress is that indeed we are very aware that we have to work very closely with IPPR and IOAC, and I hope you understood that we do everything to align the work with these two panels, as they are very, very important, and also the insightful thoughts of these two panels are very, very helpful for the IHR Review Committee. So let me just express my gratitude to all the member states, and we are also looking forward to further interventions from the member states, and be sure that we deliver all these to the 22 members of the committee that I'm happy to chair. We will do our best to make recommendations that actually strengthen not only IHR, but really strengthen the world's responsibility to keep outbreaks and pandemics as we have them now in better shape in the future. Thank you very much.
Thank you, Dr. Wheeler. Before closing this item, I would like to invite the DG to take the floor. Dr. Tedros, you please take the floor now.
Thank you, Chair. First of all, I would like to thank all the member states who gave their inputs and guidance today. And also would like to thank the co-chairs of the IPPR, the chair of the International Health Regulation Review Committee, and also the chair of the IOC for their hard work and for their presentation today. As you know, especially IOC has started its work as soon as the pandemic started. And their first report was, as Dr. Harvey said, from January to April. So one thing I would like to underline here is that the regular assessment is very, very important. But not only assessment, we have already started implementing the recommendation of IOC. We don't need to shelf it for some time to come, but it has to be implemented. We take it seriously, and we have already started implementing. And then the other issue is also, while working with IPPR and IHR Review, there are obvious recommendations and also issues that were part of our transformation, outcome of the transformation from the WHO internal transformation that was already endorsed by you member states last year, March 2019. So we're also implementing that aggressively. Then the lessons now we draw from all the 3 new lessons should also be taken seriously and implemented. And we have to be prepared to learn from the lessons. This pandemic is very, very unprecedented. And all of us should be really ready to learn from this and say, never again, by implementing what we have learned. And for the IPPR, many member states, you have said it should be independent, it should be impartial, and this was based on the resolution, and I fully agree. And because we take your advice and guidance seriously, although you asked me to initiate, and all responsibility was for me, including appointing all panel members and also hiring the secretariat. But what I did was I appointed the 2 co-chairs, that's it, then empowered the 2 co-chairs to select the rest of the panel as reported today. That makes the panel really independent. And also to hire their own secretariat and to avoid also any influence from any donor. We allowed the use of the assessed contribution. This makes the IPPR really independent. Of course, there were some concerns from member states, from few member states who have discussed with me about the selection of the two co-chairs, the first initial stage, especially with regard to consultation. One thing I would like to share with you is there was consultation, but the consultation was not like with all 194 countries. It was random and limited. Our focus was to have people or like the President Sirleaf, and the Prime Minister, high level, to lead, who are independent, to lead, and as long as the outcome of the selection is good, member states would be okay. Otherwise, you know, selecting two people involving 194 countries could be very, very difficult. And we didn't want to delay the process also. So that's why, with limited consultation, but agreeing on selecting co-chairs at the highest level possible, who are independent and who can say to anyone whatever they think is right, you know them. So as long as that's kept, we believe that you would accept, and I'm very encouraged by the level of support from all of you for the confidence in what we have done. But I believe that you deserve even more. So not only what you have decided to initiate and giving me all the responsibility, but I did everything to make it even more independent. And this will give it credibility. And from what we have seen so far, they're doing really, really, really well. And we hope to get the real lessons that we can implement and prevent the same thing from happening. But I would like to assure you that WHO is ready to learn from this and change this organization. During our transformation, we promised this. We promised to keep change as a constant. And that's why we have a unit now for continuous improvement that puts WHO into a constant improvement or into a continuous improvement. And we believe that change is constant. So I assure you, not only we will learn from this and implement them, but even going forward, we will make WHO a learning organization, an organization that evolves and prepares itself to support or to serve the world in a better way. And from the resolution and from all our discussions, that's what we understood, even before COVID. And that's what we commit again, to make WHO a learning organization and to make it better served. And as Felicity said, WHO means the Secretariat and the member states. So there is no even us and them, it's us. And that's why working together, changing this organization will not be difficult because it's us. And we have now a consensus to get the organization into a continuous improvement. So again, thank you so much for your guidance and inputs. We will do everything to make sure that we serve better and we deliver results. Thank you. And thank you, Chair, for your leadership too. Namaste. Much gratitude.
Thank you, Dr. This concludes our discussion of item 4. Distinguished delegates, we have now come to the end of the special session of the Executive Board on the COVID-19 response. Let me thank the Director General and the Board for this fruitful discussion. I would like to refer to the proposal made yesterday by the distinguished EB member from Austria for an EB retreat. I welcome the proposal and would like to consult further with other EB members and other member states on the possibility to hold a fully inclusive event when feasible. We shall return to the matter in the near future. Before closing the meeting, I would like to invite the Director General once again to say a few words. Dr. Tedros, you can have the floor again, please.
Yeah, thank you. Thank you so much. Thank you, Chair. I think I have said what I would like to say, but one maybe concluding remark is, first, thank you so much again, for this very important session. And from WHO side, we would be happy to have a regular session, board session, because we need your support and input. And I said it yesterday, we support the idea of retreat. That can help us actually to discuss openly in what ways we should really interact. So that's one, and we'd be happy to support in any way possible to make that happen. And second, I would like to say, like what I have always said, in terms of knowing the virus, we know better now. We know a lot. Still, there are unknown areas, but we know better. The most important thing now is investing in or using all the tools at hand. And many countries have shown that with the tools we have, they were able to suppress and control the pandemic. But at the same time, we have to invest in new technology, and that's why we launched the ACT Accelerator. We will need vaccines, and there is hope that by the end of this year, we may have a vaccine. There is hope. So investing in vaccines while implementing the tools we have at hand will be important and will give us better result. But especially for the vaccines and other products which are in the pipeline, the most important tool is political commitment from our leaders, especially in the equitable distribution of the vaccines. And as we have heard from Burkina Faso yesterday, not only that, in supporting also countries who need support, especially for economic recovery, in a stimulus package. Meaning, we should recover together and support those who need support. That will help us to open the world together, or for the world to recover together. And the central thing here is, I said political commitment, and that's why political commitment will be crucial. And solidarity, solidarity, solidarity. But solidarity starts from national unity. So that's what I would like to say as a last message. We need each other. We need solidarity. And we need to use all the energy we have to fight the virus. Thank you so much again, Chair, and thank you to all member states for your inputs, guidance, and from here, I think we can go on to really fight the pandemic and this pandemic. Thank you so much.
Thank you, Dr. Tedros. Excellencies, my colleague vice chairs, DG, RDs, distinguished delegates, esteemed partners, ladies and gentlemen, we have come to the close of a successful special session of the Executive Board. I thank my colleague vice chairs for their full cooperation in successful conduct of the 5th special session of the Executive Board, despite the difficulties associated with holding a virtual meeting cutting across several time zones. The rich and proactive interventions of the EB member states, as well as member states not represented on the board, have made this possible. Their suggestions and inputs will be very useful in guiding the work of the organization as we move forward with strengthened resolve to tackle this once-in-a-generation pandemic affecting all aspects of our lives. I acknowledge our sister UN agencies, intergovernmental organizations, partners, and NSAs for their commitment to support our work and for their keen engagement and participation. Amid the challenges we face, it was a privilege to spend time with all of you and listen to the experiences and best practices being followed worldwide. This was particularly seen during your interventions yesterday on agenda item 3, covering the update on the implementation of resolution WHA 73.1 on the COVID-19 response. Following an excellent report by the DG, supported by Dr. Mike Ryan, Executive Director of WHO Health Emergencies Program. Their informative and comprehensive presentations brought out the immense work that has gone into convene experts, coordinate, lead, and support the global response against the unprecedented pandemic and associated challenges related to atypical presentation of the disease, different epidemiological pathways, and trade and travel restrictions. Here, let me applaud the WHO staff at all 3 levels, the headquarters, regional, and country offices, for their sincerity and dedication. Your work is valued not only by us, but as seen in the trustworthy ratings of the authentic scientific information related to the disease by the general public in all countries. Coming to today's discussion, under agenda item 4, it was a pleasure to hear the updates, in particular from Her Excellency Ellen Johnson Sirleaf, former President of Liberia, and the Right Honorable Helen Clark, former Prime Minister of New Zealand, co-chairs of the Independent Panel for Pandemic Preparedness and Response. We have also benefited from information on the work being done by the IHR Review Committee and the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program. I thank Dr. Lothar Wieler and Dr. Felicity Harvey, respectively, for the same. We appreciate the progress that has been made by the independent panel and the 2 committees and look forward to receiving their final report and recommendations at the earliest possible. The member states' interventions and rich inputs affirms the resolve of the executive board to further strengthen the response and work towards building a healthier, secure, and prosperous world. It was evident in today's discussions that member states are mindful of maintaining non-COVID-19 essential health services and are already looking beyond the pandemic at recovery and vigorously pursuing universal health coverage with a focus on primary care services. Today's discussions and suggestions will strengthen our collective response to COVID-19 and further encourage global cooperation. To echo the DG and the regional directors' sentiments expressed during this special session, solidarity and collaboration have been and will be centrally important for us to overcome this pandemic and improve the accessibility affordability and quality of healthcare services. In the end, I thank the member states for their participation in the special session and their insightful observations and sharing their experiences. I appreciate DGWHO, regional directors, and the Secretariat team for the energy and insight they have displayed in the ongoing support to member states, not only in emergency response, but across all programmatic areas. The many non-government and intergovernmental organizations that partner with us enable us to bring in the whole of society approach in health. Finally, our sincere thanks to the translators and the ICT team for the hard work they put in to ensuring this virtual EB session was seamless. Thank you. Thanks once again, all of you, and namaskar. Now, I declare the 5th special session of the Executive Board closed.